Hello, good afternoon. This is our video lesson regarding our next topic for the DEF 3, that is first aid and basic concept. So, I know that you're done with the DRM, and I hope that you'll be able to submit your requirement or project for your pre-midterm. So that will be the basis of your grade for the pre-midterm. So I hope you'll submit it on time. So that will be tomorrow. So let's start. Let's define what first aid means. So first aid is an immediate care given to a person who has been injured or suddenly ill when medical assistance is not available or being delayed. So from the word first, it means immediately, or it means priority, or it means first, or it means una. Then we have the word aid. So it means to care, to treat, or to attend to, just to uh, provide procedure that will help the injured or the person who have been ill. So this is done before the medical assistance arrive. For example, before the ambulance arrived in the scene of accident, so you as the first aider or person who is there perform the first aid intervention. That if you are fully trained. So the history of first aid, we have the ancient practices. So even the time of the Egyptians, Greeks, and Romans, first aid is already there. So they use their available resources in order to perform first aid. So remember the when the female or the male character uses the head of the ant to stitch up the wound. So in every different places during the ancient times, they have already established ways how to treat people. Then during the 11th century, the Knights Hospitalier came. So when we talk about Knights Hospitalier, they are the medieval Catholic military order to provide care to the pilgrims and soldiers, establishing early forms of battlefield first aid. So during this time, the, the Catholicization of Christianity has been spread out throughout Europe and parts of Asia and also in Africa. So of course there are presence of resistance and battle. So that's why they formed people who will going to treat and do the first aid. So they are the Knights of Hospitalier. So actually, the word hospital came from the term Knights Hospitalier. Then we have on 1859, a Swiss or from Switzerland, businessman Henry Dunant witnessed the aftermath of the Battle of Solferino, that is in France, which led him to advocate for the creation of neutral organization to care for the wounded. So when we talk about neutral, it means no, there he is not one-sided. So even though whatever your race or your faction is or your color is, gender, it doesn't matter as long as you're wounded or needing help, then you are qualified to receive first aid. This event directly inspired the founding of the International Red Cross in 1863. Then we have the first aid in war, the Franco-Prussian War. So when you talk about Franco, that is France, then Prussian, that is Russia. In the year 1870 and 1871, saw organized efforts to teach soldiers first aid techniques, making or marking the beginning of formalized first aid education for military personnel. So during this time, they already handed the knowledge, skills, and attitude to the soldiers. So aside for fighting for the team, also they were going to help people in whichever or in whatever side. If the person is injured, then they were going to perform first aid. So this is the marking the beginning of formalized first aid education for military personnel. Take note, first aid education. So this is handing of knowledge, skills, and attitude from the trainers to the students or to the soldiers. Next is the formation of St. John Ambulance in 1877. The St. John Ambulance Association was established in UK to teach first aid skills to civilians, particularly in the industrial setting where accidents were common. So during these years, 1877, there is an industrial revolution. So there are many factories established during this time. And of course, when there is factory and there are workers, sometimes there were accident happened. So they need first aid. So St. John Ambulance Association trained those civilians to do first aid to help those who are injured in the factory setting. Next is American Red Cross. Founded in 1881 by Clara Barton, the American Red Cross played a pivotal role in promoting first aid education and services in the United States. So Clara Barton brought first aid organization to the America and established the American Red Cross. Then the World War 1914 to 1918 led to significant advancement of first aid technique, including the widespread use of tourniquet and the development of portable medical kits for soldiers. So tourniquet is a rubber band to tie on a certain place to reduce bleeding or to reduce bleeding and that beyond that area. Then first aid kits to soldiers were established during this era also. Then during the 19th century to 20th century, the concept of first aid kit was popularized and with the help of Robert Wood Johnson, the co-founder of Johnson and Johnson's, creating a portable kit for the railway worker in 1888. In 1950s, the CPR development happened or the cardiopulmonary resuscitation was widespread, a critical first aid technique which was developed at that time and was revolutionized in 1960 or widely spread or widely taught. Then modern first aid training today is widely accessible to the general public with various organizations like the Red Cross and St. John Ambulance providing courses that cover a range of emergency scenarios from minor injuries to life-threatening condition. So, mauna na ang atong gigamit na system today. Okay, next. What are the roles of first aid? Number one, it bridges the gap between the victim and the physician. For example, happen to encounter a accident in the roadside, a motor accident. So when you came to the accident area, there is no doctor available, but you yourself know how to do first aid, so you perform the basic techniques. For example, to survey the patient or doing primary survey like uh, checking the airway, breathing, and circulation. Then also after stabilizing the patient, you perform the secondary survey, checking the head to foot assessment or doing the head to foot assessment to the patient to further check if there is further injury aside from the major one. So in doing that, you are doing the role of saving the patient even without the doctor. So when the ambulance came, You endorse the patient to the ambulance and to the facility where you have to send the patient. Then there, the doctor will going to continue the care given to the patient. Number two, it is not intended to compete with or nor take the place of the service of the physician. You're not a doctor, you're not a licensed doctor, but you are trained to perform basic first aid. So the role of the doctor is to completely stabilize the patient, performing procedures medically, professionally, to fully recover the patient. So the other role as a first aiders are those immediate and on the spot aid to the given to the patient. Then once the doctor arrived in the scene, so you have to take over the role of your take your role as a first aider to the patient. No, to the doctor. I mean, then the doctor. It's up to the doctor if he or she needs your help. All right. Then what are the objectives of the first aid? Number one is to alleviate suffering. So when you have the knowledge, skills, and attitude of first aid, you'll surely be effective in treating the patient. For example, in the picture, applying cold compress to the injured part of the patient to minimize the pain felt and also avoiding the edema or inflammation or hobag. Number two, you have to prevent further injury. So once you know the standard procedure in performing first aid, you're also preventing your patient from experiencing further pain or further injury. For example, like putting or application of splint on the area where there's fracture. So there's a proper procedure in doing that so that you're not going to add more pain or injury to the patient. Then we have number three, to prolong life. So when you do or perform the first aid, you are actually helping the patient getting healed, and you have to prolong or able to prolong his life, especially when you uh when you encounter the patient without breathing or heartbeat also. So you were able to perform the standard CPR to him or her, then you successfully revive the patient. So you are trying to prolong the patient's life. What are the characteristics of a good first aider? Number one is being observant. Being observant is you have to notice the sign. You have to be keenful all the signs that the patient is showing, the nonverbal and the nonverbal, the verbal, the uh the the signs or the objective. I mean the yeah, you have to check the uh what is there or the physical signs or tangible signs that the patient is experiencing. For example, after reviving or stabilizing the patient, so you have to assess the patient head to toe so that you're going to check whether there are more injuries or if you have to check if the patient is totally okay. Then we have to be resourceful. You should make the best use of the things at hand. So you have to make all your uh stuff broth or kit broth there in the scenario. You should know how to use it and utilize it in their best capability. Then you should be gentle. You should not alarm the patient or make him fear or afraid. So being gentle, you must carefully and gently perform the first aid procedure. For example, how to do wound dressing to an area of or to the wounded area of the patient. So you have to do it gently so that you will not going to add more pain or more injury. Next is tactful. You should not alarm the victim. So being tactful, you keep on informing patient what you're doing. For example, when your patient already is conscious and stabilized, so you have to inform what happened to him or her during the time that she lost consciousness, like what procedure you performed to her and what you are currently doing. So you keep your patient informed of the things you are doing or currently doing to her or him. Next is sympathetic. You should be comforting, so you should not be harsh to the extent that your patient will produce PTSD or post-traumatic syndrome. That happened when there is really a bad experienced by the patient in that certain scenario. For example, instead of comforting the patient, you are trying to scold the patient and trying to reprimand in a bad way the patient. So possibly the patient will experience stress or anxiety. So instead, you have to comfort the patient. You have to you have to reassure that all are taken care of and just waiting for the ambulance or the higher facility to come or to tend for to the patient. This is the hindrances in giving the first aid care. So number one is unfavorable surrounding. For example, you are currently performing the primary survey to the patient, but suddenly it rained heavily. So you have to transfer your patient to the area where there is shade because when it pours, you will not able to perform well the assessment or any first aid procedure. Number two, the presence of a crowd. So, diba, usually when there is accident in a crowded area, so people will gather together, then look and admiring and to try to try to uh hero or yes, they because they're feeding their egos. So they're trying to take pictures or videos, etc. So that instance can hinder you in doing the first aid procedure. So instead, you have to instruct the people around to make a human chain and make a big circle so that you have enough space and air to perform the procedure. Next is pressure from the victim or relatives. So sometimes the parents, sometimes there are relatives nearby who will going to bug you or who are going to question what you're doing or like that, and other also parents, for example, if the victim is a kid, other parents will also be in a state of hysterical and mauna na yung tawag. So that hinders your role or your yeah, it hinders your chances in giving the emergency care to the patient. Next is nighttime. It is uh dark when the night comes, so your visual acuity or your visual prowess will not be in the optimum. So at nighttime also, less people around, so maybe it's difficult for you to ask for help. Then number five, capabilities of the first aider. So an effective first aider should be equipped with knowledge, skills, and attitude. so that he'll be effective. He will going to make his intervention successful. Alright, so here are the basic first aid equipment. Number one is splint, that is for the fracture, and also for the dislocation. Most of musculoskeletal, uh, musculoskeletal na mga issues or cases. Then we have the spine board. Spine board is used to transfer patients, especially those who are suspected head injuries and those who have spinal injuries. So this wants to protect the head and the spine from moving. Next, we have blanket. So blanket, it is easy to drag the patient when you use the blanket. It is to uh, when you use your blanket, the friction will be lessened so that the dragging will be more uh, more easy and more the patient will not be heavy. So what is inside your first aid kit? Number one, we have rubbing alcohol. It is not used to clean us the wound, but to clean the equipment you had and also your hands. Then we have the povidone iodine. So povidone iodine is a solution that is applied to the wound to be an antiseptic or to take the role of antiseptic or to clean the wound. Then we have the cotton. So you have to use cotton in placing or in applying povidone iodine to the wound. Then it is cotton also used for cleaning or drying the area. Gloves, it is to protect you and also for the patient. Protecting you, you have to use gloves because sometimes we don't know the patient is have uh, illness that might illness or bacteria that might transfer through contact. So you have to use gloves. Then scissors using to cut the gauze and also the adhesive to tailor fit to the size of the wound. Then forceps. You have to use forceps or hands in providing wound care. Then the gauze pad is when you try to stop the bleeding or try to cover the wound to stopping the bacteria to lodge in. Next is the tongue depressor. So it is used when you check the throat for choking, and also it is used when there is a seizure, then you have to protect the patient's tongue from beating from getting beat off or from getting beaten. Next we have pen light is to use for checking the pupil of the eye and also checking the throat for blockage. Then we have band-aid for simple or to minor cuts and wounds. The elastic roller or bandage for sprain or to immobilize certain parts. Next is adhesive tape to put or to contain the gauze or to place the gauze exactly where it should be. Then the cold patch is for to prevent from inflammation, to prevent the area or the injured area from inflammation. Next are the guidelines in giving the emergency care. So, number one is planning. Emergency plans should be established based on the anticipated needs and resources. So, when you are called to deploy to a parade, so your equipment should be tailored fit to the event. For example, if it's a parade, so inside your kit should be anything that is useful when someone is injured or ill during the parade. So no need to bring something from the uh, that you need for the lifeguard of lifeguarding or for the sea. All right. Then number two, provision of logistics. The emergency response begins with the preparation of equipment and personnel before any emergency occurs. So you need to prepare your kit, and also you need to make the ambulance stand by to where you're deployed to. Number three, remember the initial responses follow. Number one, ask for help. Number two, intervene. Number three, do not do further harm. So number one, ask for help. You have to ask the bystander for help. You have to let them call the ambulance or the higher medical facilities. Number two is intervene. You have to perform the first aid procedure, standard first aid procedure as required or as needed. Then do not do further harm. You should be gentle and calm. Number four, instruction to the bystander. So proper instruction, information to the bystander provides organized first aid care. So you need the helping hand from the bystanders, especially in times when you call for the ambulance. All right. So for next week, we're going to start with the reporting. So I already give you the names of I will already give you the groupings and the names cookies of group 1 to group 4. So here are the following topics you need to report. Okay, so you have to do also the how to perform first aid in that kind of injury or illness. All right, so I think that's all.